Thank you, Madam Chair, and thank you all for being here, and thank you, Madam Chair, for the work you've done to draw attention to this crisis in America. This disease is tremendously painful for families who live through the horrible experience of losing a loved one through it. This disease is also wildly expensive. I know that the chair talked about this. The United States spends $259 billion a year on health care related to Alzheimer's disease, including $175 billion for Medicare and Medicaid, and yet NIH spends less than 1% of that amount on Alzheimer's research every year. Yeah. Breakthroughs will not happen if we're not funding our scientists and keeping in the fight as they push every day to make progress. So let me see if I can just ask a couple of questions around this. Dr. Yaffe, you started your work on cognitive decline more than 2 decades ago. Do we know more about dementia in older adults today than we knew when you first started 20 years ago?
No question.
All
yes,
right.
Absolutely.
And what role have NIH grants played in your ability to stay in this fight? How many have you received over your career?
I've probably gotten about 15 that I was the lead for, and then maybe another, 15 or 20 where I was a co-lead. Obviously, it's been instrumental for me. I couldn't be doing what I'm doing without NIH funding. It's by far the most important funder for research, medical research, by far. And I want to say it's particularly important for young people. We're talking about the importance of the geriatric workforce, but we also need to talk about the importance of the physician scientist and scientists in general, who, once they finish their training, they're expected to then get a grant, often a career development award, to get so that they're from their training stage to their independent stage. This is critical, and it's critical that the NIH fund this, because otherwise people aren't going to go into science.
No, we will lose our researchers.
And in particular, it's the physician or clinician scientists who have one hand in with patient care and understand the clinical issues, and then the other trying to solve this problem. I can't tell you, having served on the review committee for this at the NIA, one of the committees, you saw wonderful people who just didn't quite get a good enough score, and you had a feeling they were not going to be able to stay in science. So I can't emphasize enough the importance, particularly for that transition period.
That's very important. And if I can ask you, Dr. Callahan, you work in a very different type of research than Dr. Yaffe. Your research examines how to improve the care that older adults with dementia and depression receive from their primary care physician. Dr. Callahan, has support from NIH also made a difference in your work?
Well, much like Dr. Yaffe said, I would not be here without NIH funding. I think one of the things that we sort of watch as we're marching along is originally the NIH is funding you as an untested junior scientist with career development awards and with an opportunity to go in a very different direction. Mm-hmm. So they're investing in you, but they're holding you in science through their support. When that's successful, then we move on to independent grant funding. But then the NIH also funds program development at our universities. So, for example, Indiana University had an Edward Roybal Center. And with the Roybal Center, then again, we splinter off. We're able to attract even more young people from a wider discipline. So at each stage in a person's career, you need the NIH to consistently be there.
And I'm about to run out of time, but with the chair's indulgence, I just want to ask Ms. Gallagher, I know that caring for your husband was a tremendous responsibility, and how painful it must be for you to know that scientists will not be likely to come up with help in time, but that you are still here, arguing advocating on behalf of future Alzheimer's patients and their families and caregivers. Can you just say a word about the importance of research as you see it and funding the NIH?
We need help. We need help. We need a cure. I'm worried about my husband's 2 daughters. The oldest is 32, and I sure would hate to think that she only has 15 good years left. I would hate to think that. She has a 6-month-old and a 3-year-old. So I hope to God that my grandkids and that my kids don't have to worry about this. So there has to be research. And just to go through, it's a life of almost daily torment of what you have to go through to keep, just everyday life. And it's absolutely necessary. It's just amazing. It needs to be cured, and it needs to be cured, as soon as possible.
Thank you. And I'll just be blunt on this. We need more money for NIH, not less.
Yes.
We need more money for NIH. Thank you, Madam Chair.
Yes.
Thank you.
Thank you.